Welcome to On the Beat, everyone. I'm Troy Thompson, and we're joined today by Dr. David Allen of the Allen Chiropractic Center. And today we're talking all about chiropractic work. Welcome to the show, my friend. How are you?
I am doing wonderful. Thanks for having me.
All right, I want to talk a little bit about why you decided to become a chiropractor.
Well, you know, it's not something I ever sat down and said, hey, one day
Oh, really?
I'm going to be a chiropractor. I am from Jackson, Mississippi. Originally, I went to Mississippi State University. Played on a golf scholarship
Now,
there.
is that when we say go Bulldogs?
That's where we say go Bulldogs.
Okay.
And did we bring up that we're national baseball champions? Did we bring that up? Okay. Anyway, went to Mississippi State University, played on a golf scholarship. What I did want to do my whole life is play professional golf.
Okay.
And I had some success, and I played professional golf for 8 years. Injured my back. I herniated a disc in my back in 1990. And after 8 weeks of 2 different orthopedic surgeons, 2 physical therapists, getting daily treatment, muscle relaxers, anti-inflammatories, painkillers, steroid injections, MRIs, I wasn't any better. By chance, I ran into my dentist while I was hobbling around town, and he asked me if I was down in my back, and I said yes. And he said, you need to go see my chiropractor. He saved me from surgery. I said, let's go see him. So I did, and I was a little skeptical about chiropractic. Didn't know anything about it, didn't know any chiropractors. And so he sends me to the chiropractor. I go see the guy. I'm waiting in the waiting room, and I look on the wall, and I notice his name is Charlie Brown. And I'm like going, of course his name's Charlie Brown. They're all named Charlie Brown. And this is the lowest point in my life. I said, I've been to all the experts. I've got terrible back pain. I cannot play. I cannot make a living. And I'm in Charlie Brown, chiropractor's office. Well, after speaking with Dr. Brown for about 15 minutes, I realized he knew more about it than everybody I had spoken with previously put together. And I was really impressed. And I was considerably better, nearly pain-free in about a week and a half.
So that was when you went, this is what's going to be my new profession.
Almost. I went through an acute care program with Dr. Brown.
Yeah.
Got my pain under control, and I was able to practice again. I started doing some strengthening stuff. He said I need to do some rehab, that I didn't need to go back out yet. And I said, well, I got PGA Tour qualifying school coming up, and it only comes up once a year. So if you don't go, you're out for a year, and you have to go overseas or do something.
And this is what I find interesting, because chiropractors get a bit of a bad rap.
Yeah.
Really, don't they?
Absolutely.
Because I'll be honest, I had never been to a chiropractor until my first one, probably 15 years ago. And I thought it was going to hurt.
Yep.
I thought they were going to break my bones.
Yep.
And I had no concept of what was going to happen. I'm sure you get a lot of that conversation when people come to you for the first time.
All the time. You know, so many things that you just mentioned there. Number one, the only discomfort or pain involved in a chiropractic adjusting is people that come to see me are hurting terribly.
Yeah.
Okay.
I
and
agree.
Moving hurts. Okay.
Yeah.
Sometimes we have to carry them in the office, and we have to move them to make them better. So it's really not the adjustment that hurts. It is the motion. Most people find their adjustment very, very comfortable. Okay?
And do people feel a sense of relief after the first adjustment or second adjustment? Like if someone's got chronic pain in their neck or arms, when you do that first adjustment, does it alleviate some pressure?
In most cases, people will feel significantly looser or better.
Right.
I was one of those cases. It was like instant relief. I certainly have cases like that all the time where we'll have instant relief. You know, I tell people all the time, because I get asked that question a lot, when's my pain going to go away?
Yeah.
I said, well, maybe right after this adjustment. Maybe you may be one of the tough ones that it takes 3 to 6 weeks for it to be totally gone. But most of them are just kind of bounce up and down a little bit while they go through it. But most of them go through pretty quickly.
And that's something, you know, I have my chiropractor in Atlanta, and sometimes I may have slept badly or something's happened, and he might say to me, come every other week for 3 visits, Troy, and you're back to normal.
Right. Well, there's different types of care, okay? And there's different types of patients. If we have somebody that comes in that just slept wrong and they've got a catch in their neck or a crick in their neck or whatever they want to call it, you know, most of the time they've just stretched the joint capsule, and you can do 1 or 2 adjustments and they'll be fine. Okay.
And that's the best thing that we like about it. You are able to fix things like this. We appreciate you, Dr. Allen.
Yes, sir. Well, you're
if you
quite
want
welcome.
to find out more information, there it all is up on the screen for you. Allen Chiropractic, give them a buzz and they're going to sort out any cracks and creaks that you may have.